When I developed the technology for looking at the central vein sign on MRI scanner, we also realized that we could capture this other component of MS plaque, what we call this iron rim or paramagnetic rim, which translates to these paramagnetic properties of the iron. So we realized this is a subset of MS plaque, the so-called chronic active lesions, and so there is high value in imaging them and studying them, right? So we, with Cedars-Sinai and the Cleveland Clinic, we are working on the multicenter analysis of data that we're collecting over the past 2 years using my technique, and the idea is to evaluate them diagnostically. So can we, as well as we did with the central vein sign, distinguish MS patient from non-MS patient by solely looking at these iron rims around MS plaques in the white matter. And so the results that were presented by my fellow, Brian Renner, show that indeed, when you start looking at large cohorts with typical MS mimics such as migraine, small vessel diseases, you typically don't see pearls. They're a very rare event. Where the MS patient tend to show at least one pearl in the brain quite frequently. So in terms of diagnostic performance, we were able to show that you can achieve high specificity, but it's not such a frequent finding as in MS as the central vein sign. So in terms of sensitivity, there is a little bit of drop-off as compared to the CVS. The beauty is we have done the analysis on the central vein sign using the same technique. So the logical next step for us is to combine the CVS and what we call the pearls together, so to better differentiate MS patient using a single MRI technique.